I'm Eberhard Rabe from Germany. I started Phlebology more than 40 years ago. I worked for a long time in the university in Bonn. Now I'm retired, but still working in patients and education. And I'm a dermatologist, which is a little bit different from many other countries where Phlebology is more dedicated to surgery and vascular surgery. But in Germany we have a long tradition, that also dermatologists do a lot of sclerotherapy, also Phlebology and all the different things, treatment of venous leg ulcers, even surgery in varicose veins. And so I decided to be a dermatologist many years ago, and then I specialized very much in Phlebology.
Okay, that's interesting that dermatology is so tightly.
It's very different, you know. If you go to let's say the whole countries which have an Anglo-Saxon connection, they come from vascular surgery, and Phlebology is just dedicated to vascular surgery. But in the German-speaking countries, the same is true for Austria and also for Switzerland. Many dermatologists do Phlebology.
And through the years, you said you are in Phlebology for 40 years. It's a long time.
Yeah.
Through the years, how it has developed?
Yeah, there have been so many changes. It's hard to say, you know, because it's not only on varicose veins, but also on thrombosis and things like that. To put it together, I would say that Phlebology has become less aggressive, less invasive also. When I started Phlebology with a deep venous thrombosis, you were confined to bed, lying into bed for some weeks, for instance. Now we treat all our patients on an outpatient basis, even with a deep venous thrombosis. So it's a complete change in the habits. And when I started with Phlebology in the hospital, after vascular surgery, like stripping operations, things like that, people stood in the hospital for almost 2 weeks. Now it's obligatory an outpatient procedure. And of course that is also true not only for surgery, but also for terminal ablation, non-terminal ablation, which is now the mainstay of treatment for varicose veins. And this has changed completely. Our understanding for superficial venous thrombosis, for instance, has changed completely. In the beginning, people were treated with antibiotics, were treated with anti-inflammatory drugs. Now it's part of the thromboembolic disease panel, and people are treated with anticoagulation. So it's many changes in those 40 years. Yeah.
About Masterclasses in general, what is the biggest benefit, what it gives
it's a good question, because in this conference here, the majority of the colleagues coming here have a long experience in Phlebology. They have more than 10 years experience in Phlebology, but they still come to the masterclass, you know, because it's a possibility, you know, to learn about new developments, to discuss the developments, you know, to not sit alone in your own clinic or hospital or your own practice and practicing Phlebology with your patients, because not all the situations are easy, and you may have questions and nobody answers the questions. So you can come to a conference like that, you can have update in the actual situation, and you can ask questions and discuss everything you would like to. And that is the best thing of it.